In this week's muscle breakdown, I'm covering a very important muscle when it comes to knee pain, possibly low back pain, patellar tracking disorder, quad pulls, and hamstring pulls, the rectus femoris. What's up, everybody? Dr. Matt Maggio here, creator of the Peak Method and founder of the Soft Tissue Revolution, where we teach massage therapists a new treatment method that allows them to easily make well over $100,000 per year, all while working less than 25 hours per week. So back at it for one of my favorite segments, muscle breakdown. And this week I'm going to be covering a very important muscle in the quadriceps. You know, the quadriceps are 4 muscles, and one of the most important ones of those is the rectus femoris, and it sits on the very top of that. And some injuries that are associated with this and a lot of people miss. One is just knee pain overall. So one of the jobs of the quads is to actually give some support straight down on the knee. The knee is kind of situated with the meniscus, and it really wants to be cushioned just like this. And the job of that quad is to give some stability down towards the knee. But over time, it gets really beat up and gets overused and develops a lot of what's called scar tissue. And scar tissue, I talk about it all the time. It's like glue that gets inside the muscle. Makes it really hard for the muscle to be able to stretch and contract. Now the quad can't do its job to support the knee. So what happens is now, instead of the knee going like this, it starts to slide and grind on itself. So a lot of meniscal tears and dysfunction in the joint can come from the quad as well. I also see the rectus femoris very involved in low back pain, especially dysfunction with the psoas and the iliacus. So many practitioners just want to go in and treat psoas. It's like psoas is the main cause for all back pain. I think that's very reductionist, and it's not getting to the true cause. What I end up seeing is a lot of dysfunction at the very top of the quad where it attaches into the iliacus, which in turn puts more pressure on the low back and can cause more issues in there as well. So I actually clean up the rectus and iliacus a hell of a lot more than I ever treat the psoas. Be careful when you're just trying to find one thing and trying to correlate that with causing that problem. And a lot of people are guilty of that, especially with the psoas. So get in there and look at the rectus femoris. Another issue I see the quad involved in, I talked about this, was quad dominance. So the quad just gets overworked. We tend to do more activities with our quads and not enough with our hamstrings, leads to a weak posterior chain. So a lot of people either end up pulling their quad a lot, or they pull their hamstring because their hamstring is trying to catch up to the quad itself. I always say your quad should be about 2 times stronger than your hamstring, but what I see so many times is people's quads are like 4 or 5 times stronger than the hamstring. So when the hamstring does need to kick on and they go to sprint or they do that, they're pulling their hamstring because the hamstring's kind of just taking a back seat and just kind of chilled out over the time to take the pressure off of the quad, because the quad is just working way too hard. Hamstring's like, hey, I don't have to do anything. Then when you actually use it, you're pulling that hamstring repetitively over and over. So it is very involved in low back issues, knee issues, hamstring issues, and quad dominance. So what I wanted to include this week was a very detailed palpation of the rectus femoris. I always say if you can't find it, you can't fix it in the first place. So I'm going to drop in from one of our trainings in the Peak Method an advanced palpation of finding the rectus femoris. I like to palpate this as I'll have the patient scoot over to the edge of the table, bring their foot here, and I'll give it a little bit of tension to open up and let it rest on my foot. And then we're going to go in here and we're going to feel that rectus the whole way up. So start down through here, and we're just going to get in here and do some compressive palpation as we go through there. We're really trying to find that spot that isn't moving how it should, doesn't compress well, and a lot of times you're going to find it right in the middle of the muscle belly, or you're going to find it high as well. Now, depending on the patient, how big their legs are, everything like that, you can usually get this top inch layer with an instrument to really go in there and break down some of that scar tissue. But as you go in deeper, you will need to get in there with your hands and get some depth and tension on there. But this rectus muscle is so important in overall knee stability, and a lot of times it gets overused and overworked when people that have chronic injuries and stuff like that. So if that test is limited, first clean up the knee flexion, then get in here and clean up the rectus and see where it's at. I hope you got something out of watching that palpation video. The next thing you want to look at is treatment of the quad. The quad is actually pretty easy to treat, specifically the rectus femoris. I do a lot of my treatment with instrument work, and I have an instrument that I created. It's called instrument scar tissue treatment. And basically with the instrument, you can get like the top layer of that quad and it can really open up. It really helps on the top part of the attachment there where I said, where that rectus femoris comes in just below where iliacus is. That tends to have a lot of dysfunction in there and can cause a lot of issues in there as well. So I do a lot of my treatment of the rectus femoris with an instrument. Once it gets past an inch, you can't get it with the instrument, and anyone that's telling you they can do that is actually full of shit. It's not actually being able to get in there that deep and get on that. Next thing I do is I go in with my hands and I get proper depth and tension, and I use a treatment that I call manual scar tissue treatment. So take homes from this whole video is, hey, know what can actually cause some of these issues, be able to find it and treat it accordingly, and really get out of that whole stigma and that dogmatic approach of like, oh, it's got to be this one thing causing all of this. And this is what happens with people with like a psoas problem. They're like, it's got to be the psoas, and we just treat the psoas all day long, but it could be coming from somewhere else. And that's where you got to get to the idea of like asking the right questions, doing functional based treatments, backing it up with palpation. And we have all that available. If you like this content and you like what you see, I do offer a full free training course, and you can find that anywhere else where you're watching this. It's listed in any of our contact information. Full free training, not trying to sell you anything, just really want to help you become a better soft tissue practitioner so you can help more people, get them out of pain, and keep them the hell away from pain pills, injections, and surgeries, which only make things worse. That's all I got for you guys on this one, and I'll see you on the next one. Bye.